Good evening, everyone. This is Todd Houghton again from Houghton Physical Therapy. Here for another session of Ask the PT, Facebook Live. Excited to be here again. I was hoping to wear a Patriots shirt, but unfortunately no Patriots jersey today. So what I'm here to talk about today is the outcome and the reason that I am looking to do this, the Ask the PT session, is to educate the public on the field of physical therapy and how people can help, how physical therapists can really make a big difference in the community for anyone that needs them. The purpose of this is to add more value. My purpose is to add more value, personally and professionally, to as many people as possible and have a bigger reach as possible. I'm really passionate about helping people, and I figured this would be a great way to reach even more people than I can as a physical therapist throughout the day. So the idea of this, the PT Live, is to have, I kind of have an introduction. I want to talk about a hot topic every week and some questions and answers, and then just a finishing up point that I want to share with people. So the first thing I want to talk about is the hot topic we're going to talk about is the physical therapist role in pain management. So what is pain management? Pain management, a lot of times when people have had moderate, mid to long-term chronic pain symptoms, and the doctor might send them for some type of pain management. People think that physical therapy isn't part of that role, but it is definitely a part of that role. One of the options that when you go see a physician is they might give you some medication, they might offer you some injections, or then even possibly a surgical intervention. So one of the things that all those do is they can kind of mask some of the symptoms. The role of the physical therapist is to really try and find out what the root of the problem is, that a lot of times in a more subacute to chronic illness or issue that they may have, they might kind of feel like they've reached the end of the road. But it's only been chronic because they really haven't taken all the necessary steps before they go to getting some medication or injections. So the role of the physical therapist is really to try and listen to the patient, to try and find the root cause of the issue that they're having. So last week when we were here, we had a significant amount of questions that I was able to answer with people, which was awesome. So we did have a few questions from last week that I didn't have a chance to answer. So please feel free to chime in with any questions that you may have related as a patient for physical therapy, a friend or family that you might have any questions about, or you're just not even sure what physical therapy is. So one of the questions from Dana last week was, what is the best position to sleep in if you have low back pain? I'll tell you one of the positions, the best position that I find is to lie on your side. And so when you lie on your side, you want to have a pillow in between your legs or in between your knees. And what that does is just going to keep your body in good alignment. Another thing that you might want to do is have a pillow kind of like a body pillow where you can hug on. So again, just to try and keep your body in perfect alignment as you're lying on your side. Either side, left or right, is fine. And then when you actually, what I find is pretty easy. If you have a throw pillow from a couch, that's easier to fit between your legs. And then when you rotate side to side in bed, it's a lot more comfortable. So again, the purpose of that is if your body is in good alignment, by having a pillow between your legs and something to hold on to, your body is a lot more comfortable. You also want to make sure that the pillow that you have, the position, so if you're lying, you want to just draw a straight line down your body. So when it's supportive enough on your side so your head is not tilted either way. The other option I think is a good option is lying on your back. And when you're lying on your back, you want to have a pillow underneath your knees. It's usually people don't find it comfortable if your legs are completely out flat. I would also say the one position to avoid is lying on your stomach. Because if you lie on your stomach, then your head might be turned, your upper body's turned, and you're kind of contorted. And sleeping like that for a long period of time is not really comfortable. Hi, Shelly. Hey, Deb. How's it going? So the next question is from Ron. Ron asked last week, I had my L3 and L4 disc surgery. what is the best exercise I can do? I still have a lot of pain in my back. That's a really good question, Ron. A lot of times, I would suggest you do go see a physical therapist to get some more information so they can do a full assessment on you. Because a low back pain, it's unlikely the surgical problem was fixed, so it's unlikely it's still part of the surgical problem. But I don't know if you have any referred pain down each leg, if you have thigh pain, back pain, or what's going on if it's just generalized low back pain. One of the things when someone does come to physical therapy is, so if we talk like a centralized area, so if we're talking about you had back pain, we don't want things shooting down each leg. So we want to have the back pain centralized in that area, and that's kind of how we would progress your treatment to make sure that it's staying generalized in your low back. So some easy things to do is we work on the flexibility, a flexibility program, but mostly it's going to be a program that we work on your core conditioning. That usually seems to be a big issue that people really didn't get enough of. Some people may not have even gone to physical therapy at that time. So we have a live question right now. Hi Jackie, how's it going from Old Saybrook? Hope to see you soon. Heather, hey Heather, how's it going? Heather's question was, my daughter's playing volleyball on Friday and she injured her thumb, not really sure how. She complained that the joint was tender and it did look slightly swollen. We applied ice for 10 minutes and she rested on Saturday. I can't see more of the question. It looks like there's a little more to the question. I guess my question would be, what is the thumb pain caused from? I would first be taking a look at, I always like to start along the whole spine. I would probably check out her neck, make sure her neck isn't too sore. I would check out her upper back because a lot of symptoms can be referred all the way down to the thumb. If she did it when she was diving, again, she might have thumb pain that's being caused from her neck. If it was just a straight, so after I clear those, I would check her shoulder and then check her elbow and then check her wrist. And if it is swollen, was it from the actual fall landing on it, or did she get a hit with the volleyball? So I would make sure she's really working on her posture. If the ice has been helpful, I would do that. But the biggest thing I do for any injury, all the statistics that I've seen is motion is the most important thing. So even over heat or ice, motion is the most important thing. So just have her keep it moving. Hi Renee, how's it going? So we have a question from Bob Milne. Which is better, heat or ice for an injury? Like I just said before, from the statistics that I've read and the studies that I've read, I don't really use a lot of heat or ice with people. I would just rather use motions. Motion is lotion, and you can never go wrong with movement. Even if you do have swelling, that's the body's own way through the movement actually help to get the swelling out. But some people do find heat or ice as effective. I would try both and see what's more effective for you.
I think that's a question for Heather.
Yeah.
Today is still sore. I took the thumb away, got her a thumb brace. With the brace, it feels better. The question is, should she have the thumb taped for practice?
Thank you, Alana. So I just got the rest of Heather's question saying that it was still sore today and that she got a thumb brace and should she have it taped up for practice. I think she definitely should have it taped up for practice just so she doesn't get any more deconditioning from being out of practice. And so yes, I would definitely say when she's doing activity, I'd wear the thumb brace. And if she can tape it up during practice, I would definitely do that as well. Question from Deb. Hi Deb, how's it going? Thanks for writing in. Last week I mentioned how computer users can have their neck in kind of more of a slouch posture. How can you combat that? In physical therapy, we have a thing called a foam roll. So the foam roll is, I think everybody should have one. They're pretty inexpensive, for $20 or $30. And there's definitely some postural exercises that you can do. I usually suggest people do it on the foam roll first. It's really going to help. It'll really help with your posture to get some flexibility in the pec muscles, because a lot of people, they're rounded over in the shoulder. So we want to make sure that you keep your shoulder in good position. And if you really want to think about it, we want to keep the head in alignment over the shoulders, which is over the torso. And having that in good alignment as you work is the best setup. I would also, if it's a home system, sometimes if you have a physical therapist you go to, they might have someone that specializes in some ergonomic setups. We do have someone here in our clinic that does that. But you can even go online and find what is the best position for you. Some things you want to think about is the height of your monitor at your desk. I suggest having a headset instead of being on the phone, kind of kinking your neck. That won't be helpful. So a headset, look at the height of your monitor, look at the height of your keyboard as you're sitting at your desk. The chair should be really supportive. Your feet should be touching the ground. Those are some basic things that I would probably look at. Hi, Jan, how's it going? You're welcome, Heather. So I have a question also from Deb from last week. What is the IT band? So the iliotibial band is a band or a structure. So if we were to look at my hip, the IT band comes from the bone over here on the side of your hip, and it comes all the way down and attaches over here on the side of your kneecap. If you kind of feel on the side, it kind of feels ropey, and it kind of goes the whole length, and it's in between your quadricep and your hamstring muscle. It's called the iliotibial band. It does not have a great blood supply itself. There are a lot of people get diagnosed with IT band syndrome, and one of the things with the IT band syndrome, it's a knee issue, but I found over years of beta testing people with the fuse box theory that I was talking about last week, if certain muscles in the glute muscles and the low back muscles and the abdominal muscles aren't working, it puts a lot of abnormal stress on the hips and other structures. And if that's the case, they can get referred pain down to your knee. So I don't really recommend anyone roll their IT band. I recommend that we're going to work on some glute strengthening that we talked about last week, some low back and some core strengthening, and that itself should help the IT band just take the pressure off. But the IT band syndrome can definitely be a really painful diagnosis to work through. So I would definitely suggest if you are having kneecap issues or IT band issues, I would definitely say make sure you go see a primary care, your orthopedic, and definitely follow up with a physical therapist. Awesome question. Another question from last week. A left knee has pain if I overdo it. There was no name with this, but the person had a meniscus repair in 2005, and they asked if the pain will ever go away. So having surgery that happened about 13 years ago, I'm surprised that the pain is still coming from the meniscus. So for any of you that don't know, as we have the knee, so as we have a knee over here, so this is the femur, which is the big bone in the upper thigh, and then we have the shin bone that comes down over here, and then we have the kneecap. This is called the patella, and then we have the quadricep tendon and the patella tendon. And if we move that to the side, and if we bend the knee, we have the meniscus right up over here. So there's one on the inside, the medial meniscus, and the lateral meniscus. So those are kind of like shock absorbers in between the knee. And if people have an injury on their meniscus, sometimes what happens is kind of like getting a hangnail. So when you have a little bit of a hangnail, it sticks out, you catch it in your pocket, and it doesn't really feel really good. So what they do is they go inside, they clean it up, and if it's a small tear in the meniscus, they just kind of shave it down, and that usually helps out quite a bit. If it's a larger tear, if there's a larger tear in the meniscus, they actually have to maybe cut out a piece of the meniscus. And what happens with that is the body doesn't create any more meniscus, so they don't want that to happen because once you lose all your meniscus, then you get then the bone-on-bone contact because there's no shock absorber, and then what happens is it turns to arthritis, and then people eventually will have to have a knee replacement. So to answer your question about the meniscus pain from 13 years ago, is I'm thinking it's probably coming from something else, some other imbalance that was created maybe from the way you walked, over the past couple of years. maybe some imbalance with your low back, your glute, your core, and that can also send referred pain down into your knee. So it's unlikely that it is still the meniscus pain, but I would follow up with your physician, and then I'd see about just getting a referral to your physical therapist just to see if they can fix what the imbalance is. Awesome question. Yeah, I got it. Yeah. So that's was a question from Robert Milne, and his question is, so what are dry needles and how do they help you? The idea of dry needling, and there's a follow-up question to that too, but the idea of dry needling is to help release some trigger points. What a trigger point is, if we have a muscle knot, I'm sure some of you feel, if you feel like up here in your trap, up over here, and you feel like you have a knot. And what happens is sometimes I will kind of think you can get a knot for a few different ways. If you had like a traumatic event, kind of like a whiplash event, where the muscles overextend and then they just tighten up a ball, like a ball. So that can be a trigger point. And the idea is, anytime, it would be like if you had like a piece of rope, and if you have a knot in the piece of rope, you could pull on both sides of the piece of rope. The knot is only going to get smaller and tighter. So you can think of it kind of releasing a trigger point as kind of undoing that knot. If we just massage over the knot, it's going to help. But if we can do a trigger point release, it's almost like undoing the knot. So then the muscle can get back to its normal length. So what dry needling does is they actually insert the dry needles into the trigger point, and that'll help to release the trigger point there. Sometimes they do some movement with it, but that is something you're going to see as pretty much a hot topic in many clinics now. A follow-up question is, what is the difference between dry needling and acupuncture? We do actually have someone here in the clinic that does dry needling, so I'm actually learning a little bit more about it myself. It's something I've never done before. As far as acupuncture, there's a few different styles of acupuncture, but and I'm not an acupuncturist, but as far as I know, the idea behind acupuncture is there are certain points in your body, certain meridians and certain points in your body that can lead to symptoms in other parts of your body. So I know if I go to an acupuncturist, they specialize in the Oriental medicine, that they know all those points, like there are some points, your earlobes, they might put them in your hands or your wrists. So when you go see an acupuncturist, it'll also help, it's good for stress relief, it's good for some trigger point release, it's good for treating some internal issues. I would definitely recommend acupuncture as well. I've had it myself, and I'm really interested to learn more about it.
Question. What type of treatment?
The next question is from Ronette. What type of treatment would you, and thank you, Bob, and thank you, Janet, for those questions. Nice seeing you again, Janet. Ronette, thank you for this question. What type of treatment would you recommend for a 1 centimeter Baker cyst? A Baker cyst is typically just a fluid-filled sac, and a lot of times where we see a Baker cyst is behind the knee. Typically, if they're really small and if they don't really bother you, they don't really do much for them. Sometimes physicians will go in. A lot of times they just work themselves out, and a lot of times people have Baker cyst there, and most people aren't even aware that it is there. A lot of times the sacs will kind of, the fluid will kind of separate where it's in the sac, but it makes it so it's not so irritable for you, but it is a very irritable thing. So sometimes they just work themselves out just through movement. Another thing is that they can go in and they can aspirate it, which is when they stick a needle in and they'll take the fluid out of the Baker cyst. And the Baker cyst, all it does is it's just a pocket of fluid that takes up space in the joint. So think about this: if you have only so much room in a joint, and now you've inflated a balloon and they're full of fluid, it can make it uncomfortable and just hard for the knee joint to move. That's the most common area where we'll see Baker cyst. It does seem it's common if someone has had, say, a meniscal injury or after knee surgery. A lot of times I'll see people that do have Baker cyst. So the options are they do nothing about it and it just kind of works itself out, or they'll stick a needle in and they'll actually aspirate out the cyst. Sometimes it comes back and sometimes it doesn't. Awesome question on that. Hi Peyton from New Jersey, how are you? Hope to see you again soon. And yes, Heather, I love acupuncture as well. Hey Janet, you know what? You can just come hang out. You don't have to get injured, but it would be great to see you too. Another question that we received from last week is, I have plantar fasciitis soaks and my PT shaved down the calluses. I'm in a great deal of pain. Is this normal? What else could I do? So my belief through my eyes is that anytime someone has any lower body injury, I'm always looking at the low back. I'm always going to start the low back and the lumbar spine first to see if anything is coming from that area of the low back. I really believe that plantar fasciitis, Achilles tendonitis, calf pulls, calf strains, IT band syndrome is a result of something mechanically up higher that needs to be addressed and needs to be fixed. So as far as the plantar fasciitis, that's an irritation. So if we look over here at the foot, there's a structure. So this was someone's foot over here, right from the side view. Okay, this is the heel right up over here. So if I flip it around this way, the plantar fascia runs from the bottom of the heel all the way down and kind of fans out to the toe. So it's on the underneath part. It's almost kind of like your arch. So people have problem with the plantar fasciitis where they get kind of like overuse syndrome or scarring. And a lot of people get it when they started a new exercise routine. It can happen if you change your footwear, if you wear high heels, and which is a lot of pressure on your arch. I found, since I've been beta testing thousands of patients over the last couple of years, that relating it back to the low back and the spine that I talked about before, before I even touch someone with plantar fasciitis, I always look at the low back and the core to kind of, see where the problem is coming from. So I like to treat it up at the low back. If we strengthen the core, work some of the lumbar spine, work some of the hips, and then we take it from there. And that actually usually clears up a little bit of it, and then it just kind of relaxes on its own. And then we end up treating what's left of the plantar fascia. The reason why people have calluses is for many mechanical changes as you're walking, different footwear. So what I would do is before I would address any issues of the calluses, I would take a look at their footwear. I would take a look to see if they have any orthotics, and I would just take a look at how they're walking, see if I can correct the stuff up a little bit higher first, and then we can take a look to see what's left down in the foot. So I hope that helps.
Should you stretch before work or after? Renee.
So thank you, Renee, for the question. Renee's question is, should you stretch before you work out or after, which is better? I always like to start a workout with a type of warm-up. So again, motion is lotion. I really think that's really the best way to start a workout. I have a whole set of exercises that I do myself for my upper body, like we talked about the fuse box. And so so we want all motion to initiate from the core. So I'm really big on doing a lot of core exercises. First, I do a whole bunch of upper body and a whole bunch of lower body core exercises to warm up. So before I do any strength training or before I do any swimming, biking, or running or anything. So I would do some type of warm up, whether it's a treadmill, bicycle, something to move first, and then I would do your workout, and then if you're really tight afterwards, I would do the stretching afterwards, because muscles, you want to stretch a muscle that's already been warmed up. If you stretch a muscle that's at the beginning of a workout, you could hurt something tear, and I can imagine that probably wouldn't feel too good. Awesome question, Renee.
Heather and neck issues with sleeping position.
Hey Payne, how are you? Your favorite. Yes, I know about your neck issues. What is the best sleeping position for you? The best sleeping position, I would say, is either on your side or on your back. But what I would do is I would definitely make sure that you have a good supportive pillow. So if you're looking at my alignment straight up and down here, right? So if you were to picture, you were to draw a line straight down right through your midline all the way down. Whether you're lying on your side, you want the pillow. So that's okay. So if you're lying on your side, what you want is you want to have the pillow so your head is in good alignment. You want your neck to be supported over here, and you want your whole head to be supported, whether you're lying on either side. And if you're lying on your back from the side, you also want your head to be supported, and you want your back of your neck to be supported as well. And a lot of times people, when they're in bed, they find it comfortable, they kind of hunch forward and go into a fetal position. I would say I'd really try and stay as upright as you can and try not to hunch over too much, as that'll add to your neck pain. So I really want to thank all you guys for tuning in tonight. I've had a lot of fun again tonight. I love answering your questions. And so there's just one more thing I wanted to talk to you about this week. So if you feel that this was helpful, and if you feel that you may be in need of physical therapy, just a couple things I wanted to talk about. So what are things that you would want to look for, to find a good physical therapist in your area? Well, one, all of us have different values in life. All of us, if you're someone that likes to bowl or someone that likes to golf, I would find someone that fits your activity level. Because, like any good relationship, it's a partnership that you want to work with. So I'd want to make sure that you have the same values as that person. So if you're active, I'd probably go to an active person. Another thing is you want to ask how they schedule their appointments. I feel it's really good to have at least 30 minutes of one-on-one time with a therapist. To make sure that they don't have too many patients in the clinic. So make sure you're just really getting the good attention that you deserve. I'd also just kind of look into their background. I know we have some really good questions about dry needling, about acupuncture. Make sure that they have, a few different options for you. The other thing, something really to go look for is if you go to their website, there's a lot you can tell about their website. And again, how much do they really believe in education? How much do they really believe in their staff? Is their staff really educated? Does the staff have a lot of experience with any of the issues that you have? So I think those are really important things. Another question you may have is, I'm not sure how to get a referral. Or I don't know what to say to my primary care physician. A lot of times, if you go see a primary care physician and let them know that you've investigated and you'd like to go see a physical therapist, a lot of times they might send you for an X-ray, or they might want to try some medication. I guess the biggest thing is just to be the best advocate for yourself and say, I really feel that this might be helpful, whether it's acupuncture or physical therapy, or anything else that you might want to try, massage therapy, anything like that. So you get the PT referral from your physician. Another question people have is, how does it work for my insurance? Well, you can just call up your insurance provider. Most people do have physical therapy benefits. Some people do have a copay. Some people might, have an insurance deductible. So that's something you could also find out. So I had a great time tonight. Thank you very much for everyone tuning in. I hope this is really helpful for you. And again, we're just passionate about helping people and having the biggest reach as possible. So thank you very much. I'll see you guys next week. Have a good night.